What we're doing in this lab, we're doing a lot of drug efficacy and resistance monitoring. And key in this theme, and the importance of what you're doing towards harnessing innovation is that you cannot beat malaria if your treatment options are not optimal. For you to say that you're working towards eliminating and controlling malaria, your diagnostics have to be right, your treatment has to be right. And for you to get the treatment right, you really have to understand what is happening on the ground in terms of what is available as treatment options, what is working for our population, and what needs to be changed in terms of treatment guidelines and all that. One of the endeavor of the institute is to be able to develop innovative ways of managing the disease, from both addressing the hosts treatment and also for the parasites, being to able to understand how the parasite behaves, but more so also to understand the mosquito that transmits this disease. KEMRI has developed various innovations, and recently we were the team that was able to develop a malaria rapid diagnostic kit, a kit that has been developed using our locally available materials, and a kit that we foresee is going to be a game changer.
I know most people have been asking about the vaccine. We know that the vaccine has been proven to be effective, and the pilot has been going on pretty well, and now I think we are at the stage where it's a matter of putting in our request to Gavi and WHO to make sure that Kenya can be a recipient for the vaccine for use at community level. And I think we'll be seeing this rolled out in a couple of months or so, and this will be coming in through the National Malaria Control Program and the KEMRI program, which are jointly working around the clock to ensure that we get the malaria vaccine coming into the country and possibly being used by the communities that are at highest risk of getting the disease, which is basically, you know, they are around the Lake Victoria Basin. And this is a vaccine that we are fairly used to because KEMRI has been involved in the development of this vaccine that has been registered, and from the early on, from the late 80s until the time that it was approved for marketing, which was in 2015. So developing a vaccine is not a one-man show. This involves several institutions around the world and several organizations, which KEMRI was one of them, and KEMRI played a critical role at the different stages of development. So this is a vaccine that we know we were part of the development, and we know how well our population received it, and possibly we know that we are not going to get any adverse effects out of this vaccine because it had been tested in our people and it was proved to be safe and effective.
Zero malaria starts with me. Zero malaria starts with you. Zero malaria starts with us.